All right, it's that time of year again when New Year's resolutions are fresh on everyone's minds. And today we are joined by Dr. Upshaw, Medical Director at NeuroSpa TMS, to talk about some things people might be overlooking with their resolutions this year. Good to see you again. Happy New Year.
Happy New Year. Thanks for having me.
So let's talk about this because I think this is so interesting. I think there's a lot of emphasis, we're guilty of it here on the show, about physical health, right? Which is important, but there's another aspect of our health that is just as important, and that is our mental health. Would you agree?
Yes, I would agree with that. A lot of people don't think about that, but it's actually, mental health is connected to physical health as well. And so I think there's a big push right now for just general wellness, and mental health is a big piece of that. And some people have been struggling with mental health problems like depression and anxiety for years, and they haven't really thought about getting treatment for it. And there is good treatment available for mental health, new treatments all the time.
Well, let's talk about the treatments, because I do think what people do know is that there's, of course, prescription meds that you can take that maybe help with your mental health. I think some people have been on them for quite some time maybe, and are just not getting the results they're wanting. They're switching a lot. They're just looking at something else. You offer an alternative that's working for people. Talk about the treatment available, that's available.
So what we do at NeuroSpa is we do TMS treatment, which is a different type of treatment than traditional treatment, which you think about maybe going to see a psychotherapist or take medications, and those are both effective treatments for depression and anxiety.
That's your background.
And that is my background as a psychiatrist. But those treatments don't work for everyone, and so TMS is an alternative treatment that's available that's actually very mainstream, but not everyone has heard about it. So we're trying to get the word out about this TMS treatment. And basically it uses magnetic pulses to target specific areas of the brain that are out of sync with depression and anxiety. And we used to think of the brain as kind of like a bowl of soup. It had neurotransmitters. We put a little salt in it, change the neurotransmitters, depression goes away. But now science has shown us that depression and anxiety are actually circuits in the brain that are out of sync that causes depression and anxiety. And so we're able to target those specific circuits with these magnetic pulses, which have no side effects. It's pain-free. It's actually a very benign type of treatment, but it has a really substantial effect on these circuits that are out of sync. And so we're able to restore normal brain function very quickly with this treatment versus medications and psychotherapy.
I've had a chance to come to your office and kind of see how it's done, which is pretty remarkable because it is a pretty relaxing environment as well, which is what you want when you're also talking about mental health. But talk about how long the treatments are, what people can expect when they come to see you. And
so we've set our office up to be a spa-like environment, and that's why we chose the name NeuroSpa. And we're really trying to take the stigma out of mental health treatment. We really are thinking of depression and anxiety as like an arrhythmia of the brain that can be fixed and treated with this. So what you do is you first call our office up, and if you want more information, you can just Google NeuroSpa TMS. We'll come up. And with a brief phone call, you can see if you qualify through your insurance. So this is a mainstream treatment that is covered by all insurances, including Medicare. So you call us up, you see if you qualify through insurance, you come and you have a consultation with us. We'll kind of walk you through the whole process. The treatments themselves are less than 20 minutes, and depending on what your situation is, you might come 5 times a week for a few weeks. You might come shorter, you might come longer. Most people actually enjoy coming to the treatments. You feel a little better after the treatments, and again, it's delivered in kind of like a spa-like atmosphere.
so how many treatments do your typical patients typically undergo? I mean, again, I know everybody's going to be different, but
so most of our patients actually get coverage through their insurance. And so insurance authorizes 36 total sessions. And so most people get all 36 because they're feeling better and they want to get all 36. But some people improve quicker and do not need to get all 36 sessions.
I'm so glad that you brought up stigma too, because I think as we enter into this new year, and I do think we are getting more open about talking about these things, but I know you've seen this for years. What do you want people to know as they're watching this morning? So many, I think, people are struggling with depression and looking for something else. What message of hope would you give them this morning?
Well, I would say, first of all, that depression is very common. About 25% of people are going to have a depressive episode that, they can get treatment for at some point in their life. And that if you've tried medicine, or you're thinking about trying medicine, or you've tried something else that hasn't worked, you really should try to give this TMS treatment a go, because again, it's covered by insurance, and it's pain-free and side effect-free. And so it's another thing that you can try. That's the big thing that we're trying to get out there, is there's 3 big treatments for depression and anxiety: medicines, psychotherapy, and now TMS. And if you've tried 2 of them and you haven't tried the 3rd one, you should really think about that.
Thank you so much again for being here this morning. Again, this is why we love partnering with you, so we can get the word out that there are other options. It may not be for everybody, but maybe, again, someone is sitting at home and finally is hearing something and maybe getting a solution that they've been waiting for. Thank you so much.
Thanks for having me.
Of course, we'll put your contact info up. So again, there is the number. As you mentioned, just Google you. You will also pop up, but there's the website too there. But we look forward to seeing you again. Again, we appreciate your time, Doctor.
Thanks.